But you're attacking me.
No,
you're
I'm
going
pointing
to
out
attack
facts.
me. I'm going to respond.
I'm pointing out facts. You can say what you want. I'm just pointing out facts.
No,
the
you're
fact
pointing out lies.
is that it is risen 3 times faster, and we know it.
Yes, you did.
I'm sorry, I didn't ask your opinion on that. And if I cared about your opinion, I would ask you, but I don't care about your opinion.
Well,
you're part of the system. You're part of the problem. You've been sitting here longer than I've even been alive.
Welcome back to Freedom Forge, the channel where truth is forged in fire and facts matter. If you believe in freedom, accountability, and common sense leadership, go ahead and hit that like button and subscribe right now, because we are breaking down what the mainstream media won't tell you. Today, we're looking at a heated Senate hearing where Markwayne Mullin took the floor and absolutely called out the hypocrisy surrounding healthcare, free speech, and the direction of this country. This hearing centered around the future of American healthcare policy, the rising costs, and the role of government agencies, including the Surgeon General, in shaping public health decisions. Let's get into it.
Thank you, Chairman. My green light was on. I thought my mic was on. I want to address a couple things. During the ranking member's opening statement, he talked about misinformation coming from this administration, and I just want to point out that the Biden Surgeon General, Dr. Murthy, was actually, a court actually ruled against him in 2023, the Fifth Circuit Court, for trying to censor free speech on social media. That's misinformation. And so for us just to throw out an accusation like that with no evidence when the ranking member was completely silent when that took place, it's really some hypocrisy there. When we start talking about healthcare not being affordable, the ranking member and I actually agree on that. The problem is you supported the same tools that got us to where healthcare is unaffordable, because ACA, affordable healthcare, which is completely unaffordable, has risen 3 times faster than inflation itself. Yet we still support it. Not we, you, the Democrats.
No, I support a national health care program which will cut the cost of health care per person. But you're attacking me.
No,
you're going to attack me. I'm going to respond.
I'm pointing out facts. You can say what you want. I'm just pointing out facts.
No, you're pointing out lies.
Is that it is risen 3 times faster, and we know it. Yet we still want to sit here and defend it. The ranking member wants us to talk about all the death that is supposedly going to be happening because of President Trump and Secretary Kennedy, because how dare they look at a healthcare system that is broken and unaffordable and try to make changes, but yet the definition of insanity is what? Doing the same thing, expecting different results, so we should just sit here and accept it? And how dare we look into vaccines to just simply look to see if maybe vaccines may be a partial cause to autism when it's rising at a rate faster than any country in the nation? How dare us look at science? Oh my goodness, science is supposed to be perfect? I thought science was always supposed to be studied. I'm for looking into it. As a father of 6 kids, yeah, I want to look into it. I want to know what's causing it, and I will turn over every stone. And so Dr. Means, thank you for saying I want to turn over every stone. Good on you. I'm not a doctor. I'm not sitting here trying to say we shouldn't do something. I'm saying let's go after it. Let's look at it. Let's question what we're doing. Let's look at the healthcare system. We can agree on that one. I just don't want to socialize it. But we can agree that it is absolutely not affordable, 100% not affordable. Yet it was supposed to be affordable. That's what we sold by Obamacare. So how about we work together and say, hey, so scrap ACA, admit it doesn't work, admit you guys made a mistake, and let's work at something with President Trump to make affordable health care healthy and affordable for everybody. But there's zero chance you guys could do that. Zero chance. Yet everybody we bring up here, you guys chastise for trying to make changes. God forbid we change and go after and try to fix our broken system. Anyways, I ranted too long. Let's talk about some...
Yes, you did.
I'm sorry, I didn't ask your opinion on that. And if I cared about your opinion, I would ask you, but I don't care about your opinion.
Well,
you're part of the system. You're part of the problem. You've been sitting here longer than I've even been alive. This is your problem. You should have fixed this a long time ago. You've been railing on it so long. What have you been doing?
I've decided not to run for Surgeon General. You're the nominee. I've decided not to accept that nominee.
That is definitely something we would never accept. Ma'am, what's your passion about health care? What brought you into this?
Thank you, Senator Mullin. For all of us, I'm just going to take a deep breath. My vision for Surgeon General and for the future of America is to get more healthy, whole food on Americans' plates and to work to systematically encourage our healthcare system to focus on the root causes of why we are sick and not just reactive sick care. This is my passion. This is why I was put on this earth. We have an incredible healthcare system. It's amazing. It's produced miracles. If we have an acute issue, absolutely you want to be in America to get that fixed. But 90% of healthcare costs are now going to chronic diseases. And frankly, having practiced, I've seen thousands of patients, worked in this system for almost a decade in clinical medicine, it's not the focus of what we as doctors are incentivized to spend our time on. It's not what's reimbursed, and this is a problem. Medical education doesn't focus on these modifiable root causes of diseases. The science is showing us through amazing emerging work in systems biology and network biology that the physiologic causes of the vast majority of diseases that are taking American lives and torturing and shortening our lives, even in our children, are connected by shared physiology and shared root causes. We need to upgrade the paradigm of the American healthcare system to educate and treat in that way. It is by far the most efficient way to treat, of course, because if we're addressing shared root causes, we're going to be able to stop the whack-a-mole medicine that's not working for us and that is so costly. And so my passion is to help work with the AMA, work with medical schools, work with Democrats, Republicans, all sorts of agencies across the government to ensure that we really move the needle on shifting the American healthcare system towards root causes. I know we can do it. There's political will. It's what Americans want. Even the medical schools are on board, but we need a vision to get there.
Thank you.
Right out of the gate, Senator Mullin addresses something that many Americans have been feeling for years now, the issue of misinformation, and more importantly, who actually gets to decide what misinformation is. He brings up the case involving Vivek Murthy, appointed under Joe Biden, where a federal court ruled against actions that attempted to influence or suppress speech on social media platforms. Now, let's be clear here. This isn't just some minor legal detail. This is about the First Amendment. This is about whether the government can pressure tech companies to silence voices it disagrees with. And Mullin is absolutely right to call out the hypocrisy. You can't stand there and accuse others of spreading misinformation while ignoring when your own side crosses the line into censorship. That's not leadership. That's control. Then we move into healthcare, and this is where things really hit home. Mullin points out what millions of Americans already know. Healthcare is not affordable. Despite promises made under the Affordable Care Act, costs have continued to rise. He states that healthcare costs have increased 3 times faster than inflation. And honestly, that lines up with what everyday people are experiencing. Let's talk about that for a second. The Affordable Care Act was sold as a solution. Lower costs, better access, more security. But what do we actually get? Higher premiums, higher deductibles, and fewer choices. And yet, instead of admitting the system isn't working, many on the left continue to double down on it. Mullin calls that out directly, and he's not wrong. Here's where the divide becomes crystal clear. On one side, you have people like Mullin who are saying, the system is broken, let's fix it, let's rethink it, let's try something new. On the other side, you have politicians who refuse to admit failure and keep pushing the same policies that got us here in the first place. That's what Mullin means when he talks about the definition of insanity, doing the same thing over and over and expecting different results. And then comes one of the most controversial parts of his statement, the discussion around vaccines and autism. Now listen carefully, because this is where people often get emotional instead of rational. Mullin is not saying vaccines cause autism. What he's saying is that science should always be open to questioning, that we should be willing to investigate, to study, to ask hard questions, especially when something like autism rates appear to be increasing. And as a father, he makes it personal. He says he wants answers. He wants to turn over every stone. That's not anti-science. That is the essence of science. Science is not supposed to be dogma. It's supposed to be inquiry. It's supposed to evolve. And when politicians or institutions act like certain topics are off limits, that's when people start losing trust. And trust is already dangerously low. Then we see a moment that really shows the frustration boiling over. Mullin directly calls out long-serving members of the system, basically saying, "You've been here for decades. Why haven't you fixed this?" That's a question a lot of Americans are asking right now. How do we have career politicians who have been in office longer than some citizens have been alive, and yet the same problems keep getting worse? Healthcare is more expensive. Trust in institutions is lower. Freedom of speech is under pressure. At some point, accountability has to come into play. Now, to be fair, the nominee responding in the hearing shifts the conversation toward prevention, focusing on root causes of disease, nutrition, and chronic illness. And that's actually something many conservatives can agree with. Because here's the truth, America doesn't just have a healthcare problem. We have a health problem. Chronic diseases are driving the majority of healthcare costs. Poor diet, lack of exercise, environmental factors. These are things that don't get enough attention because they don't generate the same profits as treatments and prescriptions. So yes, focusing on root causes makes sense. But here's the key difference. The right believes in empowering individuals, promoting responsibility, and encouraging innovation. Not expanding government control, not socializing healthcare, and not forcing one-size-fits-all solutions on a diverse population. Mullin makes that clear. He's open to reform, but he draws the line at government-run healthcare systems. And that's a critical point, because history has shown us that when government grows too large, efficiency drops, costs rise, and freedom shrinks. We've seen it in other countries. We've seen it in other sectors. And many Americans simply don't want that for their healthcare. So what's the takeaway here? This hearing wasn't just about policy, it was about direction. Are we going to continue down a path of increasing government control, rising costs, and restricted speech? Or are we going to return to principles of freedom, accountability, and open debate? Senator Mullin's message was clear. Stop pretending everything is fine, admit what's broken, and work together to fix it, without sacrificing the core values that make this country strong. And honestly, that's something every American should be able to get behind. If you found this breakdown helpful and you want more real, unfiltered analysis like this, make sure you like the video, subscribe to Freedom Forge, and turn on notifications so you don't miss what's coming next. Because the fight for truth isn't over, and we're just getting started.